Hi everyone, welcome to my channel. So in last class we have seen a classification of anemia, in which we have seen the etiological classification, which is Whitby classification, and Wintrop's classification, which is morphological classification. Okay, so you can visit last video to see this classification. So in this video we'll be talking about iron deficiency anemia. Okay, so one by one we'll learn about all the type of anemia we have seen in last classification. Okay, separately you can get a question on respective type of anemia, and you have to find out which type of anemia it is. Okay, and various questions can be asked based on that, right? So let's see. First, iron deficiency anemia. This is most common anemia in India, right? When we talk about causes, physiological causes are when demand is increased. For example, low socioeconomic condition where demand is high, but basically demand is there and they are not able to meet it. But what if when demand is physiologically increased and we are not increasing the intake? For example, during menstruation, because of blood loss, demand is increased. During growth periods of any adolescent, for example girl, during puberty, during pregnancy, okay, and lactation. So these are some conditions when demand increases and intake is normal, which we didn't increase during these periods. So in that scenario, high demand. Okay, because of diet it can happen, like poverty, socioeconomic condition, so they are not able to take any iron rich diet, so iron intake is less, and excess blood donation if anybody is doing, or excess tea or coffee intake, because that can actually chelate the iron. So whereas pathological causes like menorrhagia, piles, hookworm infestation, malabsorption syndrome, iron is not absorbing properly, gastrectomy, intrinsic factor is not there, and iron, so stomach is not there, which HCl is needed for conversion of ferric to ferrous. So we are taking iron in ferric form, and iron is absorbed in ferrous form, so HCl is playing that role. And various hemoglobinopathies are there, and absence of HCl. Okay, so these are some conditions where iron deficiency anemia can occur. These are causes. This is a very brief video talking about one classification of anemia. So let's see sign of iron deficiency anemia. So patient will be paler. You will see paler in lower conjunctiva, nail bed and skin. Okay, there will be spoon shaped nails and brittle nails, dry, okay, and flat nails. This is koilonychia, right? Koilonychia, so these are some typical presentation: paler, koilonychia, and angular cheilitis or stomatitis when lips cracks are there. At angle you will see lips cracks, right? Atrophy glossitis, where tongue you will see it is very smooth glossy tongue, right? So the tongue lose papilla, because of that it's smooth. Dysphagia can occur. Then symptoms, if we talk about generalized weakness, anorexia, loss of appetite, headache, lethargy, breathlessness, okay, constipation can occur, flatulence can be increased, nausea, palpitation, tachycardia and decreased libido. These are some symptoms which can be there during iron deficiency anemia. So diagnosis, when we talk about, the blood picture will be microcytic and hypochromic picture. What that mean to you? That MCV, when you investigate, there will be decreased MCV, and MCHC, when you investigate, there is decreased MCHC. So blood indices will be reduced. Then iron store might be reduced, decrease in serum iron. Okay, serum ferritin is basically the iron form which is stored in tissue. So serum ferritin, then increase iron binding capacity. When there is iron is reduced, iron store is reduced, then iron capacity, this is just a compensatory thing. Iron binding capacity is increased. Okay, so less iron even will be bound. So there is increase in RDW, which is red cell distribution width, which is nothing but size to volume ratio. So what is RDW? RDW is basically indicate variation and differences in small and large sizes. So there is very wide range of cell sizes you will observe in these patients, small size to large size. various cells are there. So high RDW if there, it's mostly anemia, which can be because of B12 or folic acid deficiency, sickle cell disease, sleep apnea, chronic liver disease or diabetes, heart or kidney disease. So brief about treatment plan. So dietary supplementation can be given, iron rich food can be given like jaggery, green leafy vegetable, meat, liver. Oral iron supplements can be given, iron dextrans can be infused in case of severe conditions, and BT can be infused. Okay, and it can be suggested that they should cook in iron utensils. So this is all about iron deficiency anemia. See you in next video with megaloblastic anemia. Thanks for watching guys. If you find these videos helpful, you can subscribe my channel. Thanks for watching.